Hello, everyone, and welcome to the Financial Security for All monthly webinar. I just want to let everyone know next month there will be no webinar. Please enjoy the summer. And so our next webinar will be August 31st, details to come, and we will be using the Zoom system rather than the Adobe Connect system. And so I'd like to take this opportunity to thank our colleagues from Iowa State University Extension who have done such a wonderful job hosting and managing the webinars through their system over this past time. And we'll look forward to seeing everyone in August. Today, we are going to be talking about what extension professionals say about teaching health insurance. And we're very pleased to see all of you here. We did invite people from, or members of the Creating Healthy Communities community, as well as the Financial Security for All community. So it looks like just from the participant list that we have a nice mix of people. So we're glad to have you all here. And we have many presenters today. This is part of our team, which you'll hear about. And the primary presenters will be Virginia Brown from the University of Maryland, Mary Jo Katras from the University of Minnesota, and Joan Kuntz from the University of Georgia. And I will have a little bit of a role beyond moderator today as well, since I'm part of this team. So again, the title of our webinar today is What Extension Professionals Say About Teaching Health Insurance, Results from the Nationwide Pulse Survey.
Okay. Great, thank you, Elizabeth. So to get us started, before we launch into our research and the findings and implications for the extension system, we would first like to ask people, why are you interested in attending this webinar today? As Elizabeth mentioned, we can see that there's a variety of backgrounds and people on this. So we kind of want to get an idea of what drove you to come in here. So if you could go ahead and respond in the chat box above. I'll wait a few seconds to go ahead and give people time to answer this question. So again, why are you interested in this webinar? I see a lot of people are typing right now.
Mm-hmm.
So Julie wants to, is looking for potentially new program ideas. A lot of people are currently doing some work in the area and want to know what others are saying about it, and ideas for better approaches. Okay. And there's a couple more responses coming in, so I'll wait another second before we continue. So what I'm seeing is, in general, people on this webinar are actually probably doing work in this area and are looking for some insight into what other people are doing and some ideas on what could help inform your work moving forward. So please continue typing. I'm going to go ahead and move forward with the presentation. If you have any questions throughout, we will be monitoring the chat box as this goes along. So we want to first start by giving you a little bit of a background on the whole ECOP effort. So how did this all start? How did we get here today? Well, back in 2013, the ECOP chair, Dr. Daryl Buchholz, I never pronounced that correctly, so I apologize, identified health as one of the major areas for consideration for extension nationally. We were getting ready to celebrate our 100-year anniversary here in Extension and looking for ways to, what might be useful to inform our work moving forward. And so he recognized that the Cooperative Extension system had many transformational educators that needed to address critical health issues in this country. And so with this goal in mind, the whole ECOP committee decided to look at ways to transform the Cooperative Extension system, the Cooperative Extension service. So they brought together a broad group of extension leaders nationwide with a lot of different backgrounds to identify, investigate, and develop a plan to guide health-related work. And so specifically, this task force was asked to identify priorities for health programs, identify outcome indicators for each of these priorities, and identify potential partners to become engaged in resource development, program implementation, and outcomes. And so the idea was to go ahead and begin work at the end of 2012. That's when everyone was identified and appointed. And to go ahead and create a plan to report out and propose to the National Extension directors and administrators in a relatively short time frame. And what came out of it was this new health and wellness framework. And to begin it off, the writers of this, the developers of this framework, recognized that what we are proposing for the nation's health moving forward is to do what agriculture did for the first 100 years. So the idea is agriculture transformed and created the extension system we know today, made us leaders in that field. And the idea is hopefully health will be able to do the same thing moving forward for the next 100 years. So this is the Cooperative Extension System's National Framework for Health and Wellness. So to guide the work and to help inform the way we're going to approach health and health-related programming for the next 100 years, the task force turned to the National Prevention Strategy. This strategy was developed by the CDC, the Centers for Disease Control and Prevention in Atlanta, to address health through multiple levels and influence. And so Extension realized that this is a leader in the health field and that we should align our work or seek to align our work with this. That way we can accomplish a mutually beneficial engagement with both public and private partners and engage or adopt the national strategic direction of health-related efforts. So as you can see, this is the resulting framework. In the middle of it, the overarching goal of this is to increase the number of Americans who are healthy at every stage of life. The core outcomes of this are to, we are going to be targeting the creation of healthy and safe environments and healthy and safe choices. And then with that are priorities to creating these two different outcomes, the environments and the choices. Will center around the transformation of health policy issues, education, integrated nutrition, health, environment, and agriculture systems, health literacy, chronic disease prevention and management, positive youth development, and health insurance literacy. And that is what we are here to talk to you today, is we're going to focus in on health insurance literacy within our system, the current state of it, and then implications for our work moving forward.
Okay, I'm going to be talking to you today about what is health insurance literacy and also why it's important for Extension to actually focus in this particular area. You can't actually do education and outreach on health insurance until you basically understand what health insurance literacy is. So health insurance literacy is basically the degree to which individuals have the knowledge, the ability, and the confidence they need to be able to find and evaluate different information about health insurance plans, then also select the best plan for their circumstances, and then use that plan once they have actually purchased it. So it's not just important to be able to choose a plan, it's important that people have the knowledge, the skills, the ability, and also the confidence that they need to be able to use that plan to effectively obtain the best health care possible for their families. So health insurance literacy is not just about choosing the plan, it's about evaluating information, choosing the plan, and then being able to effectively use that particular plan. So all of those things are important for Extension. Okay, why should we actually focus on health insurance literacy? I'm sure all of you can think of many reasons to focus on health insurance literacy, but I'm going to talk about two of those important reasons. that we should focus in this particular area. As you all know, Cooperative Extension has been working with limited resource individuals and families for a long time. They've been working with them to obtain services in various areas. For example, Extension has worked with people to choose Medicare Part D prescription drug plans. So they have been working with people for quite some time, helping them, learn about different things, also choose particular services. And as the actual products and services in society become more and more complex, this becomes more and more important. And that's true in finance. That's also true in the health field. And when you think about it, when people are making financial and health decisions, health insurance actually fits within, both of these particular areas. So that's one reason it's important that we focus on health insurance literacy. Also, as you know, the Affordable Care Act was passed in 2010, and it actually has given individuals more options and more control over their health insurance. A few days ago, I received a fact sheet from the CMS, and basically the number that they had in that particular fact sheet was that the uninsured rate had actually decreased by 40%. So you have a lot more people out there who are actually purchasing health insurance and having to make those health insurance decisions for themselves and their families. And so it's a great thing, and they have greater access to services, but that comes with more responsibility as well. They have the responsibility for making the best choice for themselves and their families. They have the responsibility of using the insurance, as the way that it should be used to receive the best health care possible. So they have a lot more responsibility, and they need a lot of information, so that they can be able to, evaluate and decide what works best for them and their families. So those are two of the primary reasons that we think it's really important to focus on health insurance literacy. The action team members are Virginia Brown. She is actually the chair at the University of Maryland. Mary Jo Katras at the University of Minnesota. Of course, Elizabeth Kiss at Kansas State, and myself at the University of Georgia. We also have Ken Martin, who is at the Ohio State University, and also Dina Wise, who is at the University of Tennessee. And it's actually a great team to be working with. Now, these are the responsibilities that we were actually given when we were actually chosen to be a part of this team. We were to invite additional internal and external partners as needed for maximum effectiveness, because there are a lot of people out here doing health insurance literacy. They're focusing in it in some way. It may just be one part of health insurance literacy, but there are a lot of people out here working together. So we don't want to recreate something if something is there. So we want to work with as many people as possible. Another responsibility is to identify and develop systematic programs and curriculum. And of course, we don't want to recreate something if it's already there. And so, of course, we've been doing a lot of identifying different programs. We want to engage colleagues in professional development when necessary, and also provide assistance with resource development, capacity building, social capital, and of course funding. We're looking for different funding opportunities that can actually help us with fulfilling these particular responsibilities. And then we also want to develop and launch a system-wide program impact evaluation, because that is one of the most important things, that whatever it is that we decide to do, we need to be able to have some impact data to prove that what we're doing is making a difference. And so one of the first things that we did to assist us with actually fulfilling our responsibilities was to create and conduct a health insurance literacy survey. And now Mary Jo is going to go over the specifics about that particular survey.
Perfect. Thank you, Joan. Okay, so first, the goal of our survey was to really understand, like Joan said, what was happening
out in the field. What was being done around health insurance literacy? We want to understand what is going on so we're not recreating the wheel, that we understand what resources and programs exist, and what are some of the challenges and successes that have been happening out there around health insurance literacy. So in order to do this, we had a two-phase approach. In phase one, we collected impact data from states on current health insurance literacy efforts. And in phase two, we collected feedback on existing programming and challenges to successful program implementation. In phase one, we connected with state program leaders. And in phase two, we connected with educators in charge of program delivery. Program leaders and educators from agriculture, community resiliency, and family and consumer sciences were sampled. And these disciplines were included because based on preliminary analysis and looking at what was happening that we knew, they were the most likely to teach health insurance literacy. So next, our team developed an online survey in Qualtrics that was sent out to educators in those program areas, asking them questions about what they were currently doing in the area of health insurance literacy, what barriers they were experiencing in implementing programming in this area, and what they needed in terms of future training and capacity building. A total of 170 educators from 19 states participated in our survey and responded to our survey. Of the educators that participated in the survey, 56 were nutrition educators, followed by 35 finance educators, 34 health educators, 5 agricultural educators, and 33 who indicated other. The majority of the educators worked with low-income audiences, including young adults, ages 18 to 34, and seniors 65 and over. Approximately about 37% of the educators indicated that they taught health insurance in some form. Of these, finance educators were the most likely to teach health insurance literacy, with nutrition educators being the least likely. Educators who reported teaching health insurance literacy were asked to be specific about what curriculums they used. Of the 34 who answered this question, 54% used Smart Choice health insurance curriculum, 9% used health insurance smarts, and the rest reported receiving materials from state specialists, federal resources, and local agencies. And also to note that 74% reported that they used the entire full curriculum when they taught rather than just teaching pieces of it. Educators were also asked where they got their information and what the most useful teaching resources were. The majority of the educators indicated that they use extension resources, specialists, e-extension, as well as state insurance agencies, federal government resources for information and programs on health insurance literacy. In terms of what were the effective delivery methods that were being used, you can see that they varied, but mostly education was being delivered around health insurance literacy through in-person classes, as well as flyers and fact sheets. So educators were asked about some of the barriers that they encountered when delivering programming. Educators reported that they were not confident in their health insurance literacy knowledge themselves and their ability to teach it to others. They also reported that that some educators did not include health insurance literacy in their current programming. There's not something that they were teaching. Others felt that other organizations in their communities and in their states could do a better job of delivering health insurance information. Others also stated that the politics around health insurance, the Affordable Care Act and President Obama, created resistance to education. And others reported that both time and low participation rates in their classes also created challenges in delivering education around health insurance literacy. So when educators were asked what information they would like to know about health insurance to kind of overcome some of these barriers, Almost equal numbers indicated that they wanted information on the Affordable Care Act, Medicare, and health insurance options for seniors, and also ways to effectively teach health insurance literacy. Other areas that they talked about needing more information around was knowing health insurance options for clients, information on Medicaid, tax implications for health insurance, health insurance terms, and options for dealing with families that are faced with chronic illness, and personal health insurance options for clients and small farm and businesses. So there was there's a lot of different things that educators reported that they needed to know, that they would like to know in order to deliver education around health insurance literacy, as well as overcome some of the barriers that they were seeing out in the field. So overall, finance educators were the most comfortable in delivering health insurance literacy education. And while many educators indicated that they're using standardized curriculum, there are many educators in states that are creating their own, that they are finding other resources from other places, other experts and other organizations that can help inform and fill their knowledge gaps that they're seeing in their communities, as well as the vast majority of educators are not confident in their health insurance literacy knowledge. And this was seen both in those that are actually delivering education, as well as those that were not teaching health insurance literacy. So that is an overview of what we found and what was reported on from the survey that we sent out, kind of getting that, trying to understand what was happening, what is happening out in the field. What are the needs and what are the barriers to delivering health insurance education, health insurance literacy education. So now an opportunity for us to chat a little bit about this. Were there any thoughts or surprises that from the data that we presented, from the survey results, that you had thoughts on? And you can enter those in the chat box here. Something that surprised you, or something that you wish we would have asked, something that you're doing, or how you would answer one of the questions that we talked about. I see there's some folks that are typing, so we'll wait a few minutes here. So Susie talks about how she's surprised that there aren't more people providing this type of education. And it does, and Jennifer makes a great point, another great point, that it really does reiterate that this is really complicated, but also important information that people need to know about. And as Joan talked about, there comes a responsibility to not only accessing health insurance, but then how do we use it and how do we make those informed decisions once we have it and go forth. Okay, so there's a few more folks typing, but I am going to now turn it over to Virginia. And we can keep an eye on the chat box as folks are typing as well.
Thank you. I'm actually going to take another moment. Several people are now chiming in.
Oh, yes, you are right.
What the reflection is. Susie, I agree. Extension is known for being a great source of unbiased information. So there are many opportunities to kind of go ahead and seize upon this field if people are, feel like they're empowered and are able to teach this topic. Yeah.
Yes.
Also, she is not surprised, even though she does personal finance counseling. It can be an interesting area or a weak area of knowledge. And I think that's true across the board, regardless of the discipline. Health insurance is its own unique beast, so to speak, where it's an interesting cross-section between health and finance, and then you throw in the insurance aspect, which is a whole other animal, it can be a little daunting if they're not familiar with it. So Barbara O'Neill agrees with Jennifer that if they do not feel knowledgeable about a topic, they won't teach it. And that was actually an interesting finding in there, because that is large part true, but we did see that educators who teach it and those who do not teach it both said that they were not overly comfortable with the topic. So that was generally, it was somewhat of a predictor, but regardless, everyone or a lot of people stated they wish they were more comfortable.
Yes.
Yeah. Did you want to say something about that, Mary Jo?
No, I was just I was reading what Dave was writing, and I agree. It's not one size fits all. So that's another challenge that we have as well. That there are state-based systems, and it varies, and so it is hard to create education when there is variation across states.
Mm-hmm. So we're going to go ahead and continue, but these are all great thoughts from everyone. And you're right. We weren't, as a team, I believe, we were not overly shocked to see some of the results that came in. So the next question is, what the heck are we going to do with everything that we found out? And so based on the findings, we have a decent amount of recommendations and ideas of what we want to do. One of the top reasons that people stated that they do not engage in health insurance literacy education is because they're not comfortable teaching it. They do not feel that they have the skills or capacity to do it. And so our first recommendation is that opportunities to create this capacity need to be created. So whether it be doing pre-conferences or in-service trainings, webinar-based training opportunities where people can just log on and get the information they need to sharpen their skills, all these need to be explored. The second one is programs need to be adapted to online modules. People were interested in it. People talked about how during some of the free responses that they would schedule something, but they're an hour or so away from people's locations and houses, or the office is hard to get to, and so people would sign up, but not everyone would show up. And so the idea of online modules, that way people can have just-in-time education around health insurance literacy, both as an audience and then as, for our own personal knowledge, would be beneficial. We also believe it's important to educate the state leaders on the importance of health insurance literacy. Even though ECOP created this beautiful framework, health and wellness framework, and one of the goals or one of the priority areas is health insurance literacy, we heard from many people that they did not feel that their state leaders supported this effort, or at least whatever, whether it be perception or reality, people did not believe that their program leaders, state leaders, deans of extension, whoever it might be, was supportive of this effort. And so we think that more work needs to be done to reach out to these state leaders and to get them on board if they're not, if they're kind of straddling the fence around this, or if they are in fact supportive of health insurance literacy education, making it more explicit to field educators, because that was one of the biggest differences between those who taught and those who did not teach. While both sides said that they needed more skills and capacities around the Affordable Care Act and wanted more information, one of the biggest differences was this perception of support from the state level. We also believe that some common evaluation measures need to be established. We've heard recently, over the past year or two, from different organizations. Most recently, I saw the Patel study coming out of looking at the North Central region, I believe it was, with Ohio State and all those states, that we do great work. They'd analyzed it. The return on investment is really stellar. But the main criticism is that Extension does not tell its story well. And we know that we are doing great work. We know that there are educators doing great work around health insurance literacy. So we need to go ahead and make sure it's being captured. So we believe that common evaluation measures need to be established. And then one idea, one big, bold idea that we're reaching for and have suggested is that it's not enough to develop these common evaluation measures, but we need a clearinghouse for these measures. We need a place that states can send them into, and it's being housed in one location for us to draw reports from, for us to go ahead and use as we move forward. And so the idea of a coordinated center for evaluation for all ECOP priority areas has been discussed. We suggested it, and that's something that we believe would be a great coup for our system. So how are we responding? Those are our recommendations, but what are we actually doing with them? So we are moving forward with creating many opportunities to educate the system around health insurance literacy and efforts. So we have some of the traditional approaches. We're doing conference presentations and or webinars to share findings. We're developing trainings to increase educator confidence around health insurance literacy. So for example, we will be conducting the Extension pre-conference at ASCPE in November, and you have the date right there. The goal of that conference is going to be a skill-building conference designed to help break down the barriers that educators that they have to teaching this out in the community. We are currently exploring some other approaches, essentially social media, trying to make the health insurance literacy education, professional development, a yearly training that we can offer at different conferences to continue this development and refinement of skills, and a whole host of other ideas. So what we want to ask you guys is, since you are currently in the field doing this work, we would like to know from you, what are you currently doing around health insurance literacy? I see that many people are beginning to type in the chat box. So that's great. Seeing multiple attendees type is good news for us. So Nellie says that the University of Missouri Extension has a health insurance literacy curriculum that they are using. Barbara Neal is using tweets and other social media campaigns to reach out to people, and has co-authored a curriculum for farm families under the Smart Choice umbrella. Ashley is a Medicare counselor through the CLAIM program, working with a lot of individual consultations and programs around that. So that's great. That is definitely an area that came up as being needed, more information around Medicare. So it's great to see someone doing work specifically with that. Oh, Kathy is doing videotape segments about key health details around the ACA and open enrollment, and that's a really good resource that people said that they are using or would like to use more of. Barb has said that they use Smart Choice both distance and otherwise. Oh, and Kathy Bowen also says that they are doing one-on-one assistance for uninsured taxpayers to help them learn more. Dave Young is definitely embracing the online forums. He's working to create a tablet-based technology for inmates. So these are all really good things that people are doing around it. It sounds like everyone is, or a lot of people are doing different methods, including the traditional face-to-face teaching along with different webinars. So that's really good to see everyone working on that. Please continue to respond. We're capturing all of this so that way we can see what current people are doing and where we might be able to work and support what's being done. So as we move forward, one thing that came up during our needs assessment is that people needed a way or a clearinghouse. There's a lot of noise out there about what is going on around health insurance and health insurance literacy, and it's kind of hard to filter through and figure out what's important, what's not important. So one tool that we are beginning to use with people is we have created a Facebook page to keep people informed of our efforts to advertise events, and then engage extension educators in this effort. We are also posting relevant articles related to the status of health insurance in this country around the ACA and its impact, which is something that people said they wanted to know about, that it was just too overwhelming trying to figure out where they should go to find up-to-date information. And so that is our Facebook link right there for people to go ahead and join. We probably post a couple times a week whenever there's a relevant article that we feel people should be aware of. But then as we begin engaging in pilot projects and have different things come up, we will also be posting it on there. Okay. So our next chat box is one idea that we have been exploring is creating a text messaging pilot, a social media campaign, so to speak, to educate people around health insurance literacy topics. We were actually approached by an independent organization. Ken Martin in Ohio State was approached for us to partner with one that currently exists in 10 different cities across the country. It's a wellness text messaging campaign, and they are interested in adding in a health insurance literacy component to it. So this is one effort that we are currently exploring. If we can secure the funding, this is something we are going to be doing. We wanted to find out from you, the experts in the field, what do you think is a good way to share information? Do you think this is a good way? And then what do you think we should focus in on? So again, do you think text messaging is a good approach to sharing information on health insurance literacy? And if this is a good approach, what type of information do you think would be most useful to present? Okay, responses are starting to come in. Ashley believes that it may be useful as long as they're signing up on their own. So it seems like people think that a text messaging approach might be good as long as it's specifically targeted or perhaps focusing in on small, as Barbara O'Neill put it, small bite-sized info nuggets. So keep it simple and quick to the point to make sure that people have some good information. Susie suggested that maybe this would be a good way to remind people of key deadlines. Ashley expanded upon this, like the Medicare enrollment and Part D open enrollments, depending upon the state they live in, maybe when their marketplace closes, or when they should begin preparing for open enrollment. So that's a good suggestion. Thank you. Do other people have ideas about what might work on this type of campaign? Okay, so there's a couple more comments. So Elizabeth, yeah, you're right. She responded to Kathy. We didn't think about the idea of text messages not always being safe, so that is something to consider. And then maybe have an opt-in or opt-out for the type of messages they have when they are prompted to sign in, kind of getting in at that. So these are some great ideas. Please continue responding. Again, we are capturing all of this, so that way we can, consider using them. So again, I just wanted to remind you who our action team members are. This is it. And you can contact any of us to go ahead and find out more information about how you can get involved. So what I would like to do is first thank everyone for participating and kind of open up the floor now to general questions related to the information that we presented. Or if you have any comments or suggestions that we have not touched upon, that would be great. So keep them rolling in, but thank you for coming, and any questions or comments? I'm going to let Elizabeth answer that question, Ashley. She's been spearheading the ASPE pre-conference and taking the lead on putting it all together. So, Elizabeth, do you want to go ahead and respond to that?
Sure, and thanks for asking, Ashley, about the pre-symposium. We're pretty excited about it. We envision it's going to be from 9 to 1, no, not 9, 7:30 to 1, but breakfast at 7:30 and then get started. There'll be different segments. Obviously, we want people to have an opportunity to increase their knowledge as well as build on their skills and or practice some skills. So that's really what it's developed around, and specifically the results of the survey, what the educators who participated in the survey told us that they felt they needed to learn. There's also going to be an opportunity for people to share. We will have to share some of their successes. We're calling it I Did It Ignite presentations. So there'll be short presentations. If you're familiar with Ignites, they're 5 minutes and 20 slides. So we will be releasing the call for proposals for those presentations next week, probably later in the week. And so really there'll be a variety. We anticipate a variety of activities. One of the things that came through pretty clearly that educators felt uncomfortable about health insurance terms. So we will talk a bit about the terms and give you a chance to, I think, test your knowledge. We'll have some other speakers come in. We do want to share a bit about some of the efforts that are going around the country, so we'll try to do that. Also get the administrator perspective a little bit. So we really have a lot of different things planned. We're finalizing our plans right now. Although I was on the AFCPE website yesterday looking at the registrations, and the registration for the pre-conference or pre-symposium, as they're being called now by AFCPE, are available. So you could register. But like I said, we'll be sending out more information through our listserv. Financial Security for All, Creating Healthy Communities, and any other listservs that we can think of. So if you have ideas about where we could publicize it, please go ahead and type it in the chat box too.
Okay, great. Thank you for that question, and thank you for the answer. Does anyone else have any questions or comments related to this? And thanks for sharing that resource, Barbara. We know that there's definitely a gap in education going on in the schools to prepare students to go ahead and do their own health insurance enrollment, much less understand how health insurance works. So thank you. Are there any other questions or comments?
I wondered if Dave Young might want to share a little bit. He wrote in the chat box that he's working on a secure tablet-based with a secure tablet-based company on a curriculum for inmates, and he says suggestions encouraged and welcome. So I wonder if he might be interested in just sharing a little bit about sort of the framework or what he's hoping to teach with that effort. It could help people frame their suggestions.
Absolutely.
Interesting.
Dave, want to share? How does he unmute? I'm not familiar with this.
No, actually, he would need to type it in the chat box.
Okay. If you could go ahead and type a little bit more about that into the chat box, that'd be great.
And I guess I would also like to say and invite people who are participating today that, again, the Financial Security for All community has a monthly webinar. And if there are topics that you would like to learn more about, please go ahead and let us know, because then we can work on, through Financial Security for All and or through this ECOP action team, we can certainly work on trying to obtain presenters who can address those topics. Oh, and thanks. Yes, we will be posting the recording and the slides as soon as the recording is available. And we're very glad that you found it useful. Oh, and Barbara's mentioning today is Financial Health Matters Day. And so you can follow it at hashtag FinHealthMatters on Twitter. And also, I think if you just put that hashtag in, you should be able to find other things should come up besides Twitter posts or Twitter tweets, sorry, that are using that hashtag. So if there are no other comments, questions, or observations, I think looks like Barb might be typing. Oh, good, yeah. And so Beth Honadel is with us and indicates that she participated in the Financial Literacy Education Commission meeting this morning, which Financial Literacy Education Commission is FLEC, for those of you who know that acronym. So we will look forward to seeing a summary of that meeting. And I echo Barb's sentiment. We're glad you could join us from NIFA. So I think that we can wrap up. Again, thanks to everyone who joined us on this webinar this month. Our next webinar is in August. Look for more details. If anyone has any, again, suggestions related to health insurance literacy or other topics that fall within Financial Security for All, please feel free to email me. And Have a great rest of the week and a great holiday weekend.
Thank you, everyone.